Understanding how gastrointestinal losses impact acid-base balance is critical for nursing exams and clinical practice. Diarrhea and vomiting shift arterial blood gas values in opposite directions, requiring distinct clinical assessments. Recognizing these patterns early allows for prompt intervention and stabilization of the patient's internal environment.
Diarrhea leads to the excessive loss of bicarbonate from the lower GI tract, resulting in metabolic acidosis. Conversely, vomiting removes stomach acid, which triggers a rise in serum pH and leads to metabolic alkalosis. Both conditions involve significant changes to bicarbonate levels that nurses must interpret correctly.
Nurses must monitor electrolyte levels and pH trends frequently when patients have severe GI output to prevent complications. This pattern is a high-yield topic, frequently tested on licensure exams and clinical certifications. Identifying the primary cause of the imbalance is the first step in restoring the body's natural pH.